We're all about facts, not fear, and providing information to keep you and your loved ones safe. Well, Dr. Payal Kohli joins us live again. Lemon sherbet. Cannot love it more. Mixed in with little vanilla there. Hey, Doc, today Dr. Kohli is going to tackle some recent headlines about coronavirus. We want to start with this article, Doc, from the New York Times about a study showing coronavirus can spread in a restaurant. Tell us about this.
So, Tori, this is a really important study to look at as we're thinking about opening up our restaurants in Georgia, and we just talked about opening up the casinos in Las Vegas. And I want people to understand just how contagious this virus is. So that person shown in yellow is the person that had the virus and didn't actually know it, went to a restaurant in Guangzhou, China, sat at the table in the middle, and you can see that she infected 9 other people in the restaurant, including people who were sitting farther than 6 feet apart from her. And so this really gave me a lot of pause, because what it made me realize is that in a closed environment like a restaurant or a casino, a hair salon, airflow from the ventilation system can create complex air patterns, and the air conditioner was actually all the way on the right in that diagram. And it can carry it can carry those respiratory droplets. So as we're thinking about opening restaurants, if we're talking about social distancing and putting the table 6 feet apart, hey, guess what? This just proved that that doesn't work. And what else do you do at a restaurant? You sit down and eat. So by definition, you can't wear a mask. And you're loitering. You're sitting for about an hour or hour and a half or whatever. So the time of contact is really high. So this really had me worried that we're moving along too quickly, and we really need to think again about how contagious this virus is.
That's great. And that chart made that very clear. Thank you. Next headline is older adults with COVID-19 are showing some more unusual symptoms. So explain that, Doc.
Now, this is another important one, because we've been talking about fever, cough, and shortness of breath as the warning signs. But as we get older, our body's responses start to change, our immune system changes, and then we can also have conditions like dementia or stroke, memory problems, things that can make it hard for older people to report their symptoms. So you have to have a really, really high threshold when it comes to older patients, looking for things like confusion, lethargy, or just, not being themselves, just feeling off is what a lot of people say, sleeping more, not eating as much, falling. Basically anything that seems unusual for some loved one that's older needs to set off alarm bells that this could be COVID. We've had a number of patients in their 80s present just with confusion or fatigue.
Oh, wow, that's good to know. Finally, real quick, this headline, wearing gloves to the grocery store isn't fighting coronavirus. What do you have to say to that?
I have to say that gloves do offer a barrier protection against the virus, but if they're not used properly, that can increase your risk, just like the masks. So it's really important not to forget to wash your hands. It's important to take them off properly. So you invert them as you're taking them off so that you're not touching the dirty surface. Wash your hands afterwards. Make sure you don't touch your face. And it does offer some protection, but if you're not using it correctly, it can make things worse.
Okay, so make sure once you're using gloves, you're actually using them wisely. Before we go, we all know it's time for Dr. Kohli's silver lining, l'chaim, or to life. What do you have for us today?
L'chaim, Tori. Today I have a really special silver lining, and my silver lining personally is Governor Andrew Cuomo. Not only is he eye candy and so dreamy to look at, but the way that he's opening up New York City is every healthcare professional's dream come true. He's looking at testing, tracing, and treatment. He's doing it in a really calculated, methodical approach, and that's just making him all the more attractive, because he's setting an example for the rest of the country.
Cuomo, gee, that sounds like spicy. I worked so hard on that it came out all befuddled. I find Cuomo also, and I know he can be seen as somewhat as a bully in the past. He is strong leadership, a coherent plan. I just trust him and I listen to him, so I totally know what you mean. And I wish his brother, Chris Cuomo, and his son well. Go ahead. Go ahead.
I was just going to say, if you had to choose between Chris and Andrew, who would you pick for a date?
I'll call you later and tell you. Thank you so much, Dr. Kohli. Of course, the doc returns tomorrow. So if you have a question about coronavirus you want answered by Dr. Kohli, write us on social media or email at info@dailyblastlive.com. There's no panic, just prevention, precautions, and a little lemon sherbet.